mild diatribe from the ranking member. Science is about having an open mind. Science is about disputation, debate, evidence, and it's discussed. And the contention and the back and forth is how we determine what the truth is. But if you close your mind completely to this and are not willing to listen, I think that's how science dies. That's when we say, well, the government consensus or the scientific consensus is this. Well, that's the closing of the scientific mind, and that's a recipe for a disaster. Science is also not about ad hominem and attacks. So by attacking this panel without listening to it, leaving in a huff, and having no questions, shows a small-mindedness, a closed-mindedness, and really it should be everything that we should avoid. I'm not here to be an advocate for one treatment over the other, and I will ask some tough questions to the panel. But I'm open-minded enough to listen to their side and see and try to determine whether or not it's a good treatment or bad. But to immediately close our mind, I think is a bad way of looking at this. I had a good friend die yesterday from this, so I'm not one who's saying this isn't a deadly disease. She lived a couple doors down, and we're sad. Kelly and I are both sad about what happened. About 6 months ago, we had a friend who died in their 30s. Not from the disease, but from lack of a stress EKG. She died from a terminal arrhythmia in her 30s with 2 young children, but her stress EKG was canceled because the government decided that we shouldn't do it. It was an elective procedure. It was delayed, and she died from a terminal arrhythmia. So people do also die from the decisions that people make. The most important thing is no one person is right. The panelists are not all right, and people should question them and go back and forth, and we try to figure out the truth from that. But it's a mistake to say that one person should have all the power to determine what we should do when we place too much confidence in government doctors such as Dr. Fauci. Dr. Corey mentioned that he mentioned in June about steroids. I mentioned it in March when Dr. Fauci came into my committee hearing. My first thought about the final pathway here with COVID in the end stages is it's not too dissimilar from other final pathways of adult respiratory distress syndrome. I had a friend who's a surgeon who got the strep eating flesh from operating on somebody who had it, and a blood splatter. He got it. The chance of losing your limbs is like 50 to 70%. It's like a 50% chance of losing all your limbs. I mean, it's a devastating disease, but one of the final common pathways like COVID is your blood vessels leak fluid into your lungs. It's a sort of a toxic shock kind of syndrome. They treated him with high-dose steroids, and so I raised my hand to Dr. Fauci and said, do you think steroids might have a role in this? And he sort of dismissed me and said that the studies were showing that it probably wouldn't work. But I would think most people would argue now that one of the most significant developments in the acute care of the COVID patient has been the steroids, actually, and trying to get them the steroids before they've gotten into the full ARDS syndrome. Some are even getting it at a very early stage in the disease. But that came from people asking questions, being skeptical, and not letting one doctor, such as Dr. Fauci, say, oh, that's not right, young man, go sit in the corner. We need to have an open mind. I'm not saying I'm always right. I'm a bystander, and I'm not an expert in COVID, but I try to ask the important questions.